So, welcome. My name is Michael Kaufmann. I am the director of the nature-based programs at Green Chimneys, and today I'm also here as a board member of IAHIO, and it has been a pleasure to plan a two-day conference on aging, animals, and things that go along on that topic. Joanne Fowler, the executive director of IAHIO, and I have been really trying to put together a program that is diverse and sort of addresses the topic for people from all over the world, different types of programs. And we thought day one, which is today, is primarily for topics having to do with seniors living in the community, and pets and animal contact. And then tomorrow, the second day, will be about institutionalized individuals, people who live in nursing homes, hospitals, or hospice. And one of the things that we really wanted to do is not just have this be a conference about aging populations, but that we make room a little bit for the voice of the older population and have some elders speak to us from their perspective. And the person that came to my mind as being ideally suited is Dr. Stephanie LaFarge, who is here with us today. And Stephanie and I have worked together for 30 years, and I have loved working with you, and you are one of the most brainy people I know that is always thought-provoking. And we don't really know what we're going to do today other than talk about this topic and see where it takes us. But I think at the beginning, Stephanie, you have to just introduce who you are and how you got to be where you are in your life.
Well, first of all, Michael, thank you for inviting me. It was very, very humbling to be put in the position that you have put me in, which requires that I acknowledge to myself, not only am I aging, but now I'm old. I'm one of the old people, and to explore that experience from the point of view of animals and the point of view of animal-assisted therapy and all of the things that I've done in the past, it's really different. It's really different. And I am a clinical psychologist, and I've worked for 40 years in death and dying. I'm what's called a thanatologist. My focus has always been on young people dying too soon. First it was teenagers with cancer, and then young adults with HIV and substance abuse and so on. So that experience of watching others and being with others who are dying, choosing to do that, is very different than the experience of actually getting to the age where dying is front and center in my life, something that I prepare for actively, while at the same, prepare to die, at the same time keep on living life to its fullest. Mm-hmm. And teenagers who can do this, do it magnificently. They mature and blossom in front of you, even as they pursue developmental tasks like getting a driver's license or losing their virginity, even though they're going to die in a year. With old people and older people and aging, our culture anyway doesn't have many guidelines and structures, even standardized interventions that we do to offer people a glide path to death. And especially if they are responsible for an animal or, want to be with animals, there's almost no way to officially support that and elevate it to what it should be, in my opinion. Mm-hmm. So I was, as I said, I worked for 40 years with people dying, and then I realized I would walk around on the streets of New York and realized I was only looking at the dogs on the leashes. I had not caring any longer about what was happening with the people at the other end of the leash. So I was very fortunate to get a job at the ASPCA, and at that time, the ASPCA was beginning their exploration of particularly animals in disasters, man-made and natural disasters, hoarding, all of the things that human psychopathology inflicts on animals. And that was what I was suited for. I'd become a sex therapist as a part of our attempt to save people's lives during the AIDS crisis, when condoms were the only tool that there was. And so the notion of taking what you know and using it in the field was a fabulous opportunity.
Absolutely.
And while at the ASPCA, I ran a 24/7 pet loss hotline that offered people a chance to talk about the impending euthanasia or loss of their pet, and especially how to manage that, which was something that has so assisted my own understanding of planning for my own death, because animals have their way of adapting to the dying process that I think human beings could learn a lot from if we allowed ourselves.
Absolutely.
So, so I was at the A, of course, meeting wonderful, amazing people like you, who you don't age, I do, but anyway, there's something.
Oh, go away.
Anyway,
Stop.
I know. So now that the task is to try to help myself and help other people that I know that are old people. I don't know if you have a politically correct term you like to use for old people.
We struggled with that when we put the conference together.
Yeah.
It was like, old people, aging people, the elders.
Yes.
And it's like nothing felt exactly right, but
Right.
yeah. When does it start? When does aging?
Aging starts the minute you're conceived, or,
Right.
then you're born. Then what you hope for, now that I can look back on it, is a smooth glide path into the end of your life, and one in which you are as conscious and as minimally suffering as possible. But it is a glide path, and once you, like being on a glider in the air, there's no choice. You're going that direction, and you're going to hit the ground. And once you acknowledge that, then you can watch yourself prepare for that. And are you bracing like it's going to be a crash, or can you want to try to make it smoother? I think it's one of the reasons people are so interested in assisting people, elderly people now, with ketamine and different drug experiences that will just calm that experience of being outside yourself.
Which is a whole new wave in psychology, again, going back to something that was being explored decades ago.
Right. And from my point of view, the existence of animals in our lives also helps us dissolve our boundaries. Because speaking for myself and other people that I've known, there is a natural tendency to, I would use the word detach, in a kind of spiritual sense. It's not withdrawn, it's not depressed, it's not any of those things, but there is the need to detach from other people and other things as you age, to the point that you know that death is absolutely what's on your horizon. There's, you can fudge and just say, I'm getting older, and at one point you're old and you're going to die.
Right.
So if that is the goal, to provide a good glide path, what do we need along the way to help people end up doing that?
So for the person living in the community, and of course we're talking different cultures, 40-some countries at our conference today, traditions are different. In some areas, the elderly still live with their families or stay in their homes. In other cultures, you tend to be more isolated. In North America, where we live, what role do the animals play for the person living in the community. And one of the things we wanted to avoid in this conference is to romanticize aging and being old. There are wonderful sides to every life phase, but there also are struggles. And I think, Stephanie, one of the things before we get into the animal and the role, you really responded to that idea of not to, go overly soft on the stereotype of aging.
Yeah. Right. As if we can mitigate or cure aging, we can't. Much more productive and useful, in my mind, is to face it head on. Most importantly, say the words that need to be said out loud and say the tasks that need to be identified out loud. And sooner rather than later, I think this is a place where veterinarians play an enormously important role, even for people who haven't. I mean, hopefully the person who owns an animal is functioning well, taking their animal to the vet. The vet is the person who probably can give that owner the most realistic set of expectations for what to hope for their pet as a good quality of life. More importantly, a good death. What will be a good death for this animal? And ideally, talk about that the first day you get this 8-week-old puppy. So that, and ask the owner, have you thought about the end of the life for this pet? Now, the organization that I worked for, the ASPCA, had this slogan that they loved, come adopt your forever pet from us. The implication being that if you get a pet from us, you're going to live forever and your dog is going to live forever. And that's exactly the wrong message. The message should be, if you have an animal in your life for 10 years, a domesticated pet, cat or dog, you're very, very fortunate, and you need to start planning. You need to do everything that you're going to do for yourself, that your lawyer or family tells you, advance directives, picturing the end of the life, what do you want, get that talked about, and mentioned at every single visit, because it can start to occur. The veterinarian is probably more trusted than anybody else, even family members, because in our culture, one of the problems that occurs is that even if the older person is not living at home but has interaction with their family members, that's often a conflicted triangle. The family members, or one or two of them at least, are frustrated by the amount of money being spent on this pet, or what are we going to do with this unadoptable animal that nobody likes, this old, grouchy cat. So the pet can be a drag.
Absolutely.
On giving the older person a good end. Sometimes make it impossible.
That's interesting, though, the family dynamic. I hadn't thought about that, but it's true. There's those extreme cases where somebody leaves all the money and the property to the cat, and then the children are quite angry at the animal.
That's right. And even when it's not, billions of dollars like the Noel Hemsley, it's a significant interference, because often I have observed, and I can say this, I can acknowledge this in myself, as you age and become less important in your role in a Western culture in the family, you're a figurehead, and then you're nice to have around, but nobody really wants to hear your opinion about anything. The animal is still by your side and still pays most attention to you. When other people start to dismiss you, you become more invisible. Many people feel that as they age. And we are less attractive. We are either bony or smelly or awkward and so on. And the role of the non-judgmental, unconditional love that you get from your pet can be crucial then. But that alienates many family members. And I know many circumstances, I had it in my own family, where the animal that was with the dying person was clearly unadoptable. What were we going to do when this person dies? And it was put on me to decide whether we were going to lie to the family. Was I going to take?
So this was at the ASPCA?
No, this was in my personal
in your
life.
Personal home?
Yes, and so there are multiple ages of people in the family. The children, we felt, should not be told, well, when Aunt Susie dies, we are going to kill the dog that she loved. That we wanted to avoid, and yet that was the only humane reality
Thing to do too, because the dog
for that
too
dog.
was, yeah.
That dog could not exist anywhere. And if you tell that lie, you're going to have to sustain that lie for generations. So that
Yeah, absolutely no, but I think that carries through here at Green Chimneys with the children that we work with. When we euthanize animals, we are honest. They don't just go to the veterinarian, or they don't just disappear. We really face that and support them, and I think the same has to be true at the other end. You make me think about, in human-animal interaction circles, we talk a lot about what animals do for people and what they do for us. And I suppose in some way they do the same thing throughout our lifespan, but in childhood, animals may serve certain roles. In mid-adulthood, another role. What does the animal really bring? You mentioned non-judgmentalness, but what other elements?
Well, one of the features of aging is a loss of your sources of outside stimulation. They literally are less frequent. Your friends die, etc. But your senses start to dull. And so what you can get from the food you eat or the picture, whatever is out there has a harder time getting into the brain in an impactful way. In my experience, touch is one of the things you retain the longest. So the fact that our animals don't require words from us, they almost always involve some kind of touch. And that, to me, that touch can either be amplified and even built in. I've known places where the old people didn't like being touched, or nobody wanted to touch them. So people would say, Johnny, go talk to Grandma, she's lying in the bed. Johnny didn't want to talk to Grandma lying in the bed, but Johnny was certainly willing to pet the cat that was lying with Grandma. So in petting the cat, and Johnny was petting the cat, Grandma was petting the cat, that is a form of physical contact between humans that is very meaningful.
So interesting, that's exactly the triangle relationship once again, which we talk about a lot between the facilitator, the animal, and the client.
That's right. No, that beautiful triangle. And the animal, well, it's not by chance. We have domesticated animals so that they do fit into that triangle because we need that triangle.
Right, exactly.
And we've asked a lot of animals to sacrifice a lot of their autonomy to play that role. And so it's very important that we reward them. Some of the studies, some of the research has shown that older people who have pets will exercise more, that the animal gives them a reason to get up in the morning, that they go out into the community more, and again, meet people, talk to people. The flip side, are there stresses that having an animal brings with it for an older person, and are there some downsides to it? Because I could see him also to become a pressure and a weight and a responsibility that might be pretty heavy, especially if you yourself might be struggling with your own health. All of that, and that, of course, it's the ideal is to have someone in your life, whether it's a family member or a social worker or some volunteer from an agency, who will assist with that. Just the way if you break a leg, you need crutches for a while, but it needs to be acknowledged. And the first thing most people try to do with an older person is to remove the animal. Oh, the animal's going to make her fall down. The animal's going to... And part of me says, the benefit of having the animal is worth the risk associated with having the animal. The bottom line, of course, is if the animal is starting to suffer as a result of being attached to this aging person, that's not acceptable.
And of course, the suffering often ends up being neglect. Not being able to groom the animal, not being able to take it to the veterinarian, or even feed it, or forgetting to feed it.
That's right.
I have seen that too.
Of course, and that's again where, just as we want people, if you see something, say something. We certainly want better training for our veterinarians to play a role in looking at the quality of life of the owner, not just the animal. Veterinarians can abdicate some of their responsibility by not saying, what I always recommend is that the vet have a contact person that they've been given by the older person, and the vet being very upfront. I may call this person if I'm concerned.
So when I was in my mid-20s, and at the time I worked at the ASPCA, before you were there, we never really did cross at the ASPCA. I had a little dog that I had trained as a therapy dog, and we went to nursing homes.
What was the dog's name?
Tess.
Tess.
Tess of the D'Urberville. So Tess would become part of the group, and we went into the nursing homes, Jewish home for the aged, for example, and I found early on that some of the elderly people, old people I visited, were almost more excited to see me than the dog I was bringing. Really, my son left me, nobody comes to visit me, that kind of thing. For organizations that have volunteers and staff that go into facilities with pets, what kind of training do they need for the human side of what they're encountering? How do you deal with people who have chronic illnesses, people in a hospice situation? Do you try to just go in and be as cheerful as possible? And then how do you not get overly sucked into the reality of that person's life and have boundaries?
Well, in our current thinking about how to help the community people, we don't have enough trained people. We have to have other people. So then the question is, what kind of what training is most useful and most important? And there's a fear of exposing people to emotions they may not be prepared to handle. So it kind of depends on what your tolerance for risking people's emotions. And in my field of death and dying, since everybody's going to die, there's no such thing as too much exposure, because this is going to happen to you. Clinicians, mental health clinicians, talk all the time about, if you haven't had an experience of that disease, can you actually treat somebody? And there are many people out there, especially patient advocate groups, who say, no, you can't. You don't know. That's why the 12 steps are so powerful. But most of us say, no, we don't have to have been psychotic to treat psychosis or schizophrenic to treat schizophrenia. However, we're all going to die. We're all going to die. So the sooner you can get in touch with your preparation for your own death, the better. I know of no training program that puts volunteers through that kind of education. The closest we get sometimes is euthanizing your pet. And you know, Michael, you know as well as I do how many people who go have a good experience with their veterinarian preparing them, providing a humane end of life for their pet, and they turn, that is the death I want for myself.
Sure.
And
of course, that's very, very controversial internationally, with some countries leading the way and really having made that possible. Switzerland,
that's right.
Other countries.
That's right. But one of the most touching experiences I had at the ASPCA was an elderly Jewish gentleman who came to us, euthanized, and we had to euthanize his dog, and he wanted the dog cremated. And what he wanted most of all was that he would bring us the jacket that he was going to be buried in. He already had those clothes, as a tradition, set aside. He wanted us to secretly sew the bones of the cremated bones of his dog into that jacket so his dog could be with him in the cemetery, which was a violation of Jewish taboo. The peace of mind, and then he said, I'll give you $5,000, you know, if you'll do this. And he was trying to put a number on the peace of mind he was going to get. But we found, you know, we found so often that people needed a picture, not just little kids need to know, where's Sophie? Oh, Sophie's in the clouds, or Sophie's in heaven, or Sophie's playing, you know, in a field.
Sure. So did you do it?
Oh, of course we did it.
You did?
Of course.
Okay.
Of course. Because that, you know, there was no harm to any animal in doing that.
Exactly.
And it was peace of mind for him, and a good use of $5,000. So, but I feel as a mental health professional, as a child psychologist, it is so important that for people at some phase in loss, most people, some phase of the loss, that they have a picture of some form of afterlife reunion, reunification. The Rainbow Bridge is the classic example now. But if people are thinking that way and talking that way, you can well imagine that even after they're not verbal any longer and they're really slipping into isolation and non-communication, that desire to stay together or to have someone with you that will go all the way with you is very important. In horrifying circumstances in the beginning of the AIDS crisis, there would be women who were HIV positive, knew they were going to die, so before there was any treatment, they would allow themselves to get pregnant because they said, at least I'll have that baby to die with. It was tragic that a new life was not going to get fulfilled.
Sure.
But it was of immense comfort that they weren't alone, because when you're carrying a baby, you feel there's two of us now.
Sure.
And so for people who aren't going to use that option for comfort, the animal, it can be pulled in to be with you without harming the animal.
Sure. You know, what I just really appreciate about the conversation is human-animal interaction is so often seen as something so nice and so benign, and it's fluffy and wonderful.
Yeah.
And it is. Yeah. But human beings are not fluffy and wonderful. We're complex and such layers of emotion.
Right.
And some of these examples you're bringing up just shows, you know, at the depth that we function individually, no matter who we are.
That's right.
And I've always felt that in human-animal interaction, those of us who are providing services, whether it's with horses, whether it's with dogs, we need to really tune into the human side of it.
That's right.
It's not about the animal all the time. It's yes, it's the relationship, but we need to really understand the human side. And that's why I always struggle when people are, you know, I like animals so much better than people, and, you know, I'm in this field. Well, no, you better really appreciate people too.
Well, and because that is with a domesticated animal, that animal is a prisoner of that owner. The animal has almost zero free will. Yes, he can poop in your bed, or he can, you know, jump on the table, but he no longer is capable of being on his own. Sometimes when people have a free-ranging or an outdoor, indoor cat or a dog, the way that animal knows, when that animal knows he's dying, if they're free to get out the door, they generally get out the door and go away and die by themselves. Right. That's the urge. We've you know, most of the time we frustrate that urge. Then we have to replace it with a more humane way to die. And back to who's going to play that role of getting the human being prepared to give their pet a good end of life, simultaneously giving themselves a better end of life. One of the best projects I ran at the ASPCA was placing old dogs with old people with a contract that meant no life-extending treatment is going to be provided to
For the
dog.
animal, right.
Exactly. The owner had to cope with making these decisions, advanced directive type decisions. I want this, I want that, I don't want this, I don't want that. All has to be prompted by another human being, a responsible human being. And if there's not a family member that'll do it, that's trusted, it has to be the vet or ideally the social worker who works for the vet,
Sure.
if the vet isn't willing to do it. But if
On average, how long did those dogs stay in those homes? Do you know, by any chance?
Not very long. You know, there wasn't an expectation. This was an elderly dog that would not have been, even if it had gone into the most generous home, life couldn't be extended more than a year or two.
But it was really wonderful in a way. The dog didn't get put down at the shelter immediately.
Absolutely.
It went into the community. It had some more quality of life.
And served a very, very good purpose.
For the old person.
Served a very, very
like
good
that
person
program.
because the old person wasn't allowed to ignore. The other thing that happens to elderly people, of course, is that they're living in the community. The neighbors start to say, oh, I don't want this cat anymore. I don't want to take it to the shelter. That nice old lady, she feeds cats. I'm going to take the cat to her house. That's the beginning of hoarding.
Right.
Because who's going to say no to a stray cat?
Right.
And unless the veterinarian has sees what's happening, suddenly there are more animals than that old person can handle.
Yeah.
The vet then has to call somebody.
Sure.
And that's not the same as reporting animal abuse, but that is member of the community protecting somebody who can no longer protect themselves.
So sometimes a pet can also be a stressor, and the old person can, you know, be fearful that maybe tomorrow I won't be able to go down the stairs, or you know, my pain's going to be too bad, or worrying about the bills, or you know, just really where the animal sort of adds pressure to their life rather than just joy and sort of happiness. And your thinking is that's not necessarily a bad thing.
Well, to the degree that pressure and stress is very much part of being alive, and serves a function to energize people, to keep them walking down the stairs even if it's uncomfortable. That staircase is a source of their vitality too. I did the stairs again today, even though it stressed me. So the outsider is observing and maybe identifying and wishing they could protect grandma and grandpa from that kind of a stress in their old age. Why can't they just, you know, sit on the couch and whatever? That's as the only thing in your life to be removed from stress. I don't have enough knowledge to know whether that's going to prolong your life or not, but it doesn't strike me as a healthy goal.
Yeah.
And in non-Western cultures that really everybody has to pull their weight until the very end, and that's a good thing. Nobody's put out to pasture or ignored or
You still have a role.
isolated or anything like that. Having the role and fulfilling the role is vital for some old people, even if you complain about it and even if it's a source of stress. So somebody out there, maybe a doctor, maybe a veterinarian, can help decide what that balance should be, and you know, offer the owner a safe landing for themselves. This is again where animal-assisted therapy comes in. Yes, this dog may go to a different home, a new home, but you will have the following experiences. And there's been some very successful substitutes of therapy dogs, therapy dolls, whatever. You know.
Absolutely. Wow, well, we have certainly covered a lot of ground and a heavy topic, and I really appreciate your your insight. I think to end it, I'd love for you to talk to me
All right.
as I'm aging and all of us who are part of the conference. You mentioned before the retaining the joy in life and retaining the how have you, as you've aged and grown older and thought about your death, how have you kept the joy in your life, and what beyond animals, sort of very general, what is your recommendation to us?
I have zero interest in joy or happiness as a goal. Because of the work I do and the work I'm chosen to do, I am, for years, every single day was filled with news of who's dying today, who's been just diagnosed, what parent am I going to go talk to who went to bed last night thinking they had a family of 3 healthy children and woke up the next day and found out one was going to die. That's one of the results and I have 7 children. So while I was doing that work and having my own children at home, every day that my child was healthy, I could be directly grateful for. And in a Western culture where we're isolated from so much suffering, especially animal suffering, but people suffering too, you have to put yourself into that experience or a structure that gives you that experience, that then you can feel the blessing of gratitude. Nothing bad happened today. My child did not die today. I did not get diagnosed today.
I really, really value the advice you just gave, because again, this idea of you need to have joy, you need to have, just bliss, and that it's not that gratefulness piece. I think I'd like to end on that.
All right.
Because thank you.
Thank you. Thank you, Michael. As always, just talking with you, the way you carry not just a conversation from one point to another, but you carry a person from one place to another. And you've always done that.
Thank you. Thank you. Thank you.